Hello out there, viewers. My name is Dr. Fumi Bankole. I'm a consultant ophthalmologist and a member of the Redeemed Christian Church of God, Lagos Province 40. I'll be talking to you on a blinding eye condition called glaucoma. Glaucoma is a condition characterized by damage to the nerve that connects the eye to the brain, and by so doing causing loss of the field of vision. If, for instance, looking straight ahead, a person is supposed to see as wide as to the end of the room over there and over here. The person that has suffered damage of the visual field from glaucoma may not see beyond their immediate vicinity. So the periphery of the visual field is lost. Also, there may or may not be a raised intraocular pressure in the eye. The normal pressure is between 10 and 21 millimeters of mercury. There are different types of glaucoma. We have the type that are secondary to other conditions like trauma or other inflammations that has taken place in the eye, such as a condition called uveitis, in which case we say it is secondary glaucoma. But majority of glaucoma cases are what we call primary open angle glaucoma, and this is responsible for more than half of those who have glaucoma. Primary open angle glaucoma is believed to be hereditary in nature because research has shown that those who are siblings or first degree relatives, such as offsprings of such people who have glaucoma, are at increased risk of also developing glaucoma with age and over time. What are the risk factors that have been associated with glaucoma? Those who have refractive errors, such as eye myopia. Myopia, that is short-sightedness. There are some people, the degree of short-sightedness is very severe and the glasses is very thick. These are the people that we classify as having high myopia. Also, those who have high levels of hypermetropia, that is long-sightedness, also have increased risk of having glaucoma. With increased age and race, the black race has been found to have a more severe form of glaucoma. So with age also, this increases the risk of glaucoma. Some conditions have been associated with glaucoma, such as diabetes mellitus, those who have high blood sugar, and also those who have high blood pressure, especially the systolic blood pressure. All these have been associated with the condition called glaucoma. In majority of cases, like I said, which is the primary open angle type, there is no sign, no symptoms, no pain, no redness, no complaints at all. But gradually, the nerve that is connecting the eye to the brain is being snuffed out over time. And this is why glaucoma is called the silent thief of sight. Hence, it is important for us to check our eyes routinely. Once every year is ideal for those who are 40 years and above. But for those who have family history of glaucoma, that is, maybe one of our parents have been diagnosed to have glaucoma, or one of our brothers and sisters have the diagnosis, then we need to check our eyes once every 6 months. When we request for a check on our eyes in order to detect glaucoma, what are the things that should be done? The pressure in the eye should be checked. The pressure is above 21 millimeters of mercury, then such a person should take extra precaution, because some people have such high pressures but they don't have any evidence yet of a damage to the nerve. But that pressure needs to be checked, monitored, to ensure that it's not associated with nerve damage. Also, we need to check the angle of the eye in a test we call gonioscopy. That's we check if the angle of the eye is open or closed, which actually helps us to make the diagnosis of open angle or angle closure glaucoma. We also need to check the back of the eye, the fundus, where we use the ophthalmoscope to look at the nerve at the back of the eye. That also gives us, the degree of damage to the nerve that we're talking about, because we have a measure by which we say that the disc, that is the nerve at the back of the eye, if it is having an area of 10, the normal thing is that the cup within it should be between 3 to 4. If it is more than that, then we say that there's suspicion of glaucoma. And then we go on to check the visual fields to measure how much of the field is intact, and if there is damage to the field, how much of the field is lost. So by the findings of all these tests, your doctor will be able to make a diagnosis if a person has glaucoma or not, and also the degree of damage. And when he puts all this together, he'll be able to put an appropriate plan together for the treatment, in which case you may be started on medication, some eye drops. Some people use more than one. There may be need to use a combination of 2 or 3 eye drops, in which case the level of the pressure will determine what is to be used, and also the type of glaucoma will determine which particular type or particular class of medication to use. Some also benefit from the use of lasers and surgery, that is surgical operation. The physician is in the position to take a decision on which modality or which combination of modalities to use for the treatment of glaucoma. If you have been diagnosed to have glaucoma, then it is important for you to also let your siblings know, let your parents know, and your children, anyone that is getting to 30 and above, they need to check their eyes regularly, so that once this condition is starting, it is detected early. If it is detected early and treatment is implemented in the early stage, it would prevent visual loss or damage to sight or blindness. So this information is to help us to take informed decision about our eye health, and it is our belief that after listening to this talk, each and every one of us will go and have our eyes checked if we are 40 and above. Thank you very much.